talk a little bit about the home healthcare market. And so there is a lot going on, certainly in the home healthcare space. And so a lot of people know that I talk a lot about ADNs and BSNs, certainly registered nurses getting into nursing school and progressing on. But certainly, I want to make sure that we do give some due credit to another space in healthcare, especially at the LPN and CNA level, and that is with the home healthcare space. Okay, and so when we talk about the home healthcare industry, I mean, right now, currently, this is a $3.6 billion industry. Okay, and so if you think that's a big number, by 2030, that number is expected to almost double to over $660 billion, right? And so if you're looking for an opportunity and a space to really get into, right, this is definitely one of those spaces you can get into and be very, very, very profitable in. Okay. But how do you do that? Right? Becomes the question. Okay. And at what level can you do it? So you have different people who are certainly serving um, the population, and so the majority of the majority of the people who need home healthcare services are going to be over 65, right? So obviously some of your retirees and more elderly patient pool who need help at home, who need those home healthcare services, right? And so about 10,000 people per day are actually turning 65, right? And so that number is only going to grow with the baby boom generation. There's a huge spike of people who are certainly turning 65, okay, or older, and it certainly will be eligible and in need actually of some of the home health care services. Okay, and so with that, you do have a swath of the population also who are really caring for their loved ones, right? And so whether they have a certificate as a CNA or an LPN or a registered nurse, right? Some people are even without those particular the medical education, are actually helping their loved ones, and so there is the opportunity to do exactly that. Okay, but now what I want to talk about is certainly the opportunity for you to get into that space and certainly leverage your skill sets not only from the healthcare perspective but also the business and real estate perspective. Okay, and so I look at deals all the time for assisted living facilities and nursing care facilities, but there's certainly the opportunity for you to not only, like I said, work in that space or work in that nursing home, work in that assisted living facility, and that may be one house. It can be as simple as one patient in one house, or it can be one house with multiple patients in one house, or it can be a larger building, right? So it can be a 16-bed complex, right, or a 64-bed complex. I just saw one today in the Baton Rouge, Louisiana area. That's actually for sale right now. Okay, and these are not complexes that are hard to get into. Just like when you buy a house, there's the opportunity to buy an assisted living facility. And so either buying the real estate and or buying the business, okay, or buying the real estate and then putting your business into that particular real estate. Okay, and so there are a lot of certainly red tape that you have to get through and get past to do that. But if you're willing to understand what that process is, what that process looks like, then definitely it's worth it. Okay, and so when you talk about the patients, a lot of patients are in a lot of the organizations, right? So whether it's Medicaid or Medicare, a lot of the third party payers, the health insurance companies, these are the ones who are paying for those services. Okay. And so instead of just looking at, hey, let me be a small provider for those services, let me just find this one patient. How about you actually start the facility? How about you take control and organize the facility? Right. And so, with your skill sets and with what you know in healthcare, especially if you've been a CNA for 15 years. You've seen a lot of the different platforms. You've seen a lot of the different options in terms of how these platforms are run. Right. And so if you're looking for that opportunity to really get into that space, then definitely let's talk. Okay. And so comment below. Let me know if this is a space that you want to get into. I'll do more videos where I expose more of the processes to not only get into this space from the real estate side, but also from the business side as well. And so if that is something that interests you, definitely let me know in the comments below, and we'll take a deeper dive into it. But right now, I can tell you it's a very, very, very profitable space, in a space that is growing about 7% per year. Even the stock market doesn't grow 7% per year right now. Okay. And so you're not getting those kind of returns, but we're talking close to 8% per year right now, about 7.96% per year. And so, like I said, by 2030, it's expected that this will be a 6.7 670 billion-dollar industry, and so close to doubling over the next couple years here. And so, are you ready to get into that space? Are you poised to get into that space and really looking to not only deliver care, but actually deliver leadership, deliver mentorship, deliver the opportunity to really build generational wealth for you and your family? And that's really what the American dream is all about. So it's not about working, 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 and working yourself to death, but actually working smarter and not harder. So definitely go and work hard. You have to work hard in order to get anything in life, right? You have to start it off. You have to understand what you're doing, what you need to know to be able to get into that space. But then the next level is, once I know this, this information I need to know, then how exactly do I use that to grow something bigger than just me? Right. And so, so with that, that's where this can be a great opportunity for CNAs, for LPNs, for MAs, right? For dialysis techs, right? And so you actually have more insight and knowledge than you really, really know, right? And so it's just a matter of putting that together with the right people and coalescing that information and that knowledge so that you too can not only be just an employee there, but also an owner there, right? And so own the business and or own the real estate or both. Okay. And so these are definitely possibilities, right? And so don't always look at the price tag either, right? And so you may want to consider a franchise. And so that's one of the ways to get into the home healthcare space. There are a lot of companies that are actually offering franchises, right? But again, don't really look at the price as much as you look at, can you make the deal work? Right. And so if you have a set of patients, for example, right, and who can occupy a particular facility, right? Let's say there are 20 beds in the facility, and each bed is bringing in 1,000, 2,000, $5,000, right? Just depends on what kind of needs they have, and so you have to kind of dictate what type of needs are you willing to serve. Okay. And so once you kind of establish that and you have your particular criteria in place, then you want to kind of figure out what are the numbers, work those numbers, right? See if the revenue from that particular endeavor and that particular action, and working with those particular patients will actually yield enough to be able to pay for the franchise fee, the mortgage, right? All of these different things that all these different costs, I should say, that you're going to encounter relative to that particular project. And so if you can actually see that the income, the gross operating income from the property and from running the business, right, will actually pay for the expenses and actually leave money left over. So your, what we call your gross operating income minus your expenses, gets you to your net operating income. And so if that net operating income is actually positive and it's enough to actually pay for the mortgage on the property and then also have money left over for cash flow, then it sounds like that might actually be a good deal. And so the question to you is, can you maintain that? Right? So can you go in there, open up the space, open up the opportunities, right? Bring patients in, right? Care for those patients, communicate with the family members, make the connections with the different agencies, right? But also make the connections with the different payers. Okay, and so if you understand the billing codes, if you understand the procedures that need to be done, do you understand the equipment that you need to be able to fill a nursing home facility, right, or assisted living facility, right? And so, what are the metrics that you would need? What is the spacing that you would need? I know it seems like a lot, but once you number one start learning about it, but number two, if you're already in the space, if you're already in a nursing home, working in a nursing home, working in an assisted living facility, then why are you not taking notes? You should be taking notes, lots of notes. that give you a clear understanding of, okay, if they can do it, I can do it. What do I need to do in order to get there as well? Okay. And so I'm not saying go overstep your employer, but certainly make sure that you're taking notes, because just like they did it, you can do it too. Okay. And so, what are those components that you need to fulfill the requirements, right? To be able to get the license, right? Or get the authorization to be able to run this particular nursing home, this facility, right? What are the requirements for the mortgage on the actual physical asset, right? And so you'd actually be surprised how easy it is to get a mortgage on a larger asset. And so it's easier to get a mortgage on a larger building, a larger asset that has a business and a profitable business behind it than it is to get a mortgage on your home based upon your current income, right? And so when you go and get a mortgage for a house, a single family house, right? They are looking at your personal income. How much money do you bring in? Right. But when you go and get a mortgage on a larger structure, a larger building that is for the purpose of being used for assisted living or a nursing home facility or something like that, they're not looking at your income. They don't really care about your income. What they care about is that business, are the tenants essentially, right? And so the assisted living facility tenants, right? And so in terms of the patients who are there, right? Are they going to be there consistently? How much do they pay per month, right? What is the revenue that is being generated from the property? Okay. And so that's what they're looking at. They're actually looking at how is the property doing? How is the business doing? And based upon those metrics and those numbers, they will actually lend on the building, right? They will actually lend on the business, for the business and for you to run your business. And so with that, don't think that you have to be, a big, memorial hospital or something like that in order for you to get into this space. You don't have to. You can actually, as an individual, right, set up your LLC, right? Have you done that yet? Okay. And so set up your LLC, get your EIN number, right? And so again, if you live in Florida, for example, I live in Florida. I have several different LLCs. Go to sunbiz.org and type in whatever you want to start a business, I should say, and then go ahead and pay for your LLC. Once you have your LLC paid for, it's $175, but I think you can do the same thing in any other state in Texas. I think it's about $300 to start your LLC. You don't need a lawyer for that, right? You can just go start your LLC, right? You can even do an incorporation if you want to, okay? And do an S corp if it's solely you, okay? And so with it, I'm not giving accounting advice or legal advice, by the way. Just let you know that this is how it goes, okay? But certainly consult an accountant or lawyer if you feel like you need more insight on this, okay? But you can set up your LLC. Okay, set up your EIN number, right? It's free to go and get your EIN number. Once you have your LLC and your EIN number, then you go get a bank account. Once you have your bank account set up, right? You have your LLC, you have your EIN number, you have your bank account. At that point, you can contribute to your business financially if you need to, right? But at that point, you can start running your business. You can start making those connections with the payers, making those connections with the agencies. Figure out what licenses do they need, what licenses do they want. Go after those licenses. Sometimes you'd be surprised. It's just a matter of applying. Right. And so it's not even that they need a whole bunch of things. Sometimes it's just a matter of figuring out, okay, what website do I go to? What building do I go to? Right. And so how do I apply? Okay. And so with that, make sure that you're talking to other people. Make sure that you're talking to your colleagues. If you are working in a nursing home, if you're working in an assisted living facility, if you are working in that space already, let me know. Comment below. Let me know what you're doing, how you're doing it. Okay. And so if you are thinking about going from just being an employee for that nursing home or that assisted living facility and going into ownership of a facility like that, then let's talk more. Right. And so again, it's a matter of just putting the pieces to the puzzle together. And I just gave you three pieces right there, right? But again, add on that fourth piece, add on that fifth piece. Okay. And so let's talk together about how we can work together to actually help you to get a piece of this big pie. This is a huge pie. Okay. And so $660 billion by 2030. right? And so by 2030, it's expected that the home healthcare industry is going to grow by almost double what it is currently. Okay. And so those are just projected numbers. It's likely going to be much bigger. Okay. Of an industry. Okay. Even if it grows 50% from what it is now, it's at $360 billion right now. So even if it got to 500 billion, that's still a big chunk, a big piece of the puzzle, right? A big piece of the pie, I should say. And so if you're looking to get a piece of that pie, then definitely we should talk more about it. Okay. And so would love to get your insight, get your comments. Please let us know. We do have some of the people and colleagues and students in our ecosystem in our classes who actually share their insight on not only the personal care and personal stories about how they're caring for loved ones and how they've worked in this space as well, but in addition to that, we'll talk about how to really go from just being an employee or someone who works in that space to someone who owns that space. Okay. And so if you're looking to own the space, if you're looking to really get into the space, right? Yes, there are a lot of home healthcare agencies out there. There are a lot of players in the space. But again, it's a very, very big pie that is not dominated by one or another business, right? And so, if you have a better product, if you have a better service, if you have more insight or better insight, then why not put it out there, right? Why not you do exactly what you know can be done? And so, if you see certainly shortfalls, and you see, um, just discrepancies in care, right? Disparaging outcomes, then certainly it's time for you to step up. Right, this is your opportunity. If you know that it can be better, it should be better, and you have the secret, and you have the wherewithal to make it better, then why can't it be you? Right? And so let's talk more about that. I'll actually show you how to find some of these deals and where you can find some of these deals in terms of nursing homes and assisted living facilities that are actually for sale right now. Right. And so with that, I look at these deals all the time. I had one, like I said, just come across my desk today, a 64 unit in Baton Rouge, Louisiana. Okay. And you can look that one up as well. But there are other ones all over the country. Okay. And so with that, if you're looking for an opportunity to really go to the next level, take your life to the next level, but have something that you can actually call a business that is profitable, right? Based upon your knowledge of healthcare, but also your knowledge of business and your ability to get into it, then definitely let's talk more. Like I said, comment below. Let me know what you guys want to learn about it, and certainly provide your insight. We can learn from one another. Okay. And so hopefully that was helpful, and hopefully that was a message. Again, I know I talk a lot about RNs and BSNs, but like I said, definitely we do need the CNAs, we do need the LPNs, and certainly at the home healthcare level and the assisted living facility level, right? This is a great opportunity not only for LPNs and ADNs, I mean LPNs and CNAs, but also ADNs and BSNs, right? And so a lot of these nursing care facilities, they actually have to have and are required to have an RN on staff. Okay. And so maybe that could be you. Okay. And so if you are looking to get your RN, you are looking to get your BSN, and you're trying to get past the TEAS test or the HESI exam, and you're looking to take it to that next level, definitely reach out to me. I'm Dr. Brian Atkins with the Atkins Academy. Okay. 301-960-4950. I'd love to help you get past the TEAS test, get past the HESI exam, and get into a really, really great, not fake nursing school. Okay. So avoid the fake nursing schools. If you missed that video, definitely take a look at that video, because I think that was one of our episodes that we did recently. Definitely take a look at the fake nursing school videos. I told you how to avoid those fake nursing schools. But I'm here to help you get your score into the 80s and 90s so you can be competitive for one of the real nursing schools. Okay. And so with that, if you're looking for an opportunity to really get on that path and get your RN, and maybe you don't want to necessarily work in the hospital and or be a travel nurse, which those are great opportunities and great options, but maybe you're more business inclined and you want to really take advantage of the opportunity to step into a business platform, right? As you have your RN, right? Then definitely let's talk more about that, because that's where I can help you to get into assisted living facility facilities, and certainly operating on that particular level. Okay. And so comment below if you want to hear more about it. You want me to do more videos about it? Want me to kind of explain it a little bit more? I'm happy to do that as well. And so let's work together to grow together. Okay. So it's not just about health care, but it's really about wealth care. Okay. And so in this decade, we are going to see a lot of changes. There's a lot of changes coming down the pike. Okay. From artificial intelligence to chat GPT-3, right? And automation and just all of that, to robotics that we're going to see, right? But also we're going to see major, major, major changes in healthcare. And so this is your time to take advantage of those changes. Okay. And so don't just sit around and be a healthcare worker. Actually, be a healthcare transformative person, right? And so transform the way healthcare is done. You have the opportunity to do that right here, right now, today. And so let me help you to do that. Let's work together on that. And I'm happy to take your questions and comments. And so definitely comment below. Let me know if you want to hear about this more, want to learn about this more, want to understand the industry more. And I'm happy to certainly bring on other co-hosts who I'm happy to interview, and you can hear their perspective as well. Okay. And so we'll have more of that also. Okay. So feel free to reach out to me, 301 happy to have a conversation and happy to talk to you more about this. Okay. And so definitely check out our other videos as well, because it definitely dropping lots of knowledge on other aspects within the healthcare industry. And so definitely check those out as well. Subscribe to our channel, like and subscribe. You'll get the notifications when we go live. But I'd love to hear your feedback, so feel free to comment on any of the videos. Take a look at our other videos as well, as we talk about the TEAS test, talk about science, English, reading, and math as well. Okay. All right. So again, you have the opportunity right now, right here, this next decade in the 2020 to 2023. So this decade that we're in right now is about to be a booming, booming, booming decade. I'm telling you, it is really, really the time. So if you're looking to really take your life and take your opportunities to the next level in healthcare, but also in wealth care, as we talk about, then definitely let's talk more about it. All right. All right. With that, we're going to have a good night. And definitely thanks a lot for tuning in. And feel free to reach out to me anytime. I'm Dr. Brian Atkins. Happy to help you. All right. And so we'll see you next time. So next week, Monday, 8 o'clock, we'll be online. We'll go live again and do another podcast. Okay. So stay on the lookout for that. All right. Thanks a lot, everyone. We'll see you for the next one.